for over 30 years. Bipin, if you'd like to give us just a brief career synopsis of yourself, and then you can move on to describing how the Bexley project came into being, how we did it before COVID, and how we're likely to do it after COVID.
Thank you, Raj. So some of you may know me. I'm Bipin Patel. I'm the chair of Bexley Bromley Greenwich LPC, together with being a contractor in Bexley. I've been a contractor in Bexley for well over 30 years. So I've seen a lot of changes, and I've seen a lot of patients' health deteriorate and improve as time goes on. But the Bexley children's asthma pilot came about because we all know that asthma is one of these conditions that really nobody should be suffering with. Their symptoms can be easily controlled, and obviously the data in London about children was on the increase. And obviously we thought that, and Bexley's data overall was poor, and we thought this is an ideal opportunity for us to try and make an improvement for the patients of Bexley. We had some keen GPs who were willing to be involved, and Dr. Karen Upton was part of the project, and she was a good facilitator to try and make it work for us. We involved, the pilot consisted of using a local surgery that we use quite often, myself, and there was another 2 surgeries that were involved. And we used Sonar device, a platform for us to work with, which was used to record the data and to communicate with the GP. So, and we used a couple of them. Can we have a look at the slide regarding the picture? Sorry, Darish, can we just move it up further? So obviously this is some screenshots from Sonar, so you can see that the platform we were using was going to be children friendly, and obviously they were interacting with it. It's something that was quite useful for us, because to me, I think that young persons, if we can get them, make a difference for a young person at this age, then it's a habit that is going to stay with them for years to come. And we started off with about 12 patients with a target, but unfortunately with the pilot and one thing and another, we never managed to get to 12 patients to evaluate the data. But I think the data is still there to show the improvement we've made with the patients of Bexley. Part of the problem was that some of the surgeries weren't quite up to speed. I think manpower was an issue, and with some pharmacies having capacity issues or change of pharmacies, which I think is a constant problem with lots of pharmacies. Can we have a look at the next slide? Or do you want to put the video on just to give us an idea as to what went on, Darush? Just go back one. Yeah. Asthma is not a condition where children need to suffer. It's part of them, but it's something that shouldn't stop them from doing anything they want to do.
And we need to see the video. It's not on there.
Great difference. My name is Bipin Patel. I'm the pharmacy manager at Broadway Pharmacy, Bexley Heath. In Bexley, we're doing a pilot service, working with NHS England and Healthy London partnerships, but also working in conjunction with.
Darush, we can't see the video.
Oh, I see. Okay.
25 years old. Evidence has shown that we seem to forget those patients.
Let me. I played it and it didn't seem to play straight away for some reason. Is it playing now?
We can't see the screen. We can hear it, but we can't see the video on screen.
So what I'm going to have to do is I'm going to put stop share and then share again with the video screen on, if that's okay.
Yeah, that's a good idea. Thank you.
Okay. You see it now?
Yeah, that's great. Thank you.
Asthma is not a condition where children need to suffer. It's part of them, but it's something that shouldn't stop them from doing anything they want to do. And this is one where the pharmacists can make a great difference. My name is Bipin Patel. I'm the pharmacy manager at Broadway Pharmacy, Bexley Heath. In Bexley, we're doing a pilot service, working with NHS England and Healthy London partnerships, but also working in conjunction with the local GPs. specifically targeting patients 5 to 25 years old. Evidence has shown that we seem to forget those patients. There's quite a sizable population of the youngsters who get overlooked, whose symptoms are not controlled. We feel that this is something that we can improve as pharmacists. We can change the way they do it. Patients are identified in the pharmacy when they're walking with the prescription. You know, the service is primarily done, as with all MURs and NMSs, by the pharmacist. It really doesn't take more than 10 minutes. It's just an extension of what we do with some supporting evidence and some videos that you can show to your patients. The only subtle difference is that we have used an IT platform to record the information. But what the IT platform does is actually prompts you to do it and asks you to make sure that you ask the right questions so we gather the right information that the GP or the asthma nurse can use. What we're going to do, Sam, is just go through your inhalers, see how you're getting on with them, just to check, see how your asthma is controlled. Yeah, I'm going to ask you a few questions, and then you just tell me exactly how you feel. All right? Good. You can actually send a referral to the GP and actually put your own comments on there. So we've had a few patients that have come in who haven't had their flu jabs. Being asthmatics, they should be having a flu jab. If they're a young person, obviously they'll have the nasal spray. You can actually highlight that by putting in your comments to say this client requires a flu jab or a nasal spray and follow it up. The GP's got all the information at hand and he doesn't have to run through the whole lot with the patient again, so saves time and is well prepared with what is expected when the patient walks in and what the requirements are. So it's a win-win in making full use of all the professionals' time and using the expertise of all the different health professionals within the primary care team. And it's something that I think we should be doing more and more of, because there are lots of other conditions that we can be working with. So how do you feel about your asthma today? Is it good, very good, bad, or very bad? Bad. Today's bad, is it? Okay. We've had patients come in and when they've gone out through the consultation, when they've had the consultation, they're actually appreciative of what we've offered them. So it's a service, I think, that really is quite important. And it's one where we can make an impression. And obviously, if you've impressed a young person, they're going to be with you as one of your patients for years to come. The reason I got involved with the service is from the spec, I realised the benefits that it was going to have to my patients. At the end of it, the patient walks away empowered about their own condition, able to manage their condition. And we as pharmacists should be doing that as a normal role. And if they're at an age where we can get them to pick up the right habits, and once they pick up the right habits, they will stay with them for years to come.
Let me stop the jingle.
So I think the bloke in the video summarised it very well. He's probably better than me, I think. But on a serious note, I think asthma is one of these things that us pharmacists should be very comfortable with managing and looking after the patients, and really making sure that every time an inhaler goes out, that the patient's technique is checked, because it doesn't matter how often you do this, they will still do something wrong. And I'm sure there's enough data out there to show how correct we are in making sure that we address that every time we do an inhaler. Now, obviously, as Raj has highlighted, the issue about the emergency supplies under CPCS, again, that is something that every time you have one of those, we should really get them to sit down and go through with it. It could be that obviously they're using more because the symptoms are worse, but it could be that they have poor technique. But it is an ideal opportunity for us to make sure that we intervene. And if need be, there is a GP referral form on there, so we can use that to send information to the GP to ensure that they're fully aware of how their patient is managing their condition. If they need a review, or if they haven't got spacers, we need to make sure that they're using the spacers or the brown inhalers. And these are all things that we do all the time, and we should really make a point of doing it every time an asthma patient walks in. When their symptoms are controlled, they'll be grateful to you for actually looking after them. As far as I'm concerned, that is all we need to do. obviously making sure flu jabs is something else we need to address, because it's coming to the time of the year when they all need to have their flu jabs. I know there's a supply issue with them currently, but I'm sure that things, when they come back to normal, we will be able to address that as well. As far as I'm concerned, that is all I wanted to say about the children's and young persons pharmacy scheme in Bexley. And I'll now hand it back over to Raj to continue.
Oh, thank you very much, Bibi. Yeah, so I really wanted to make sure